We're going to do the go around and just have an update from everyone, which I'm dying to hear because it's been too long. Before that happens, I came across another great document, and I just want to introduce it to you and tell you a little bit about it and recommend it to you. I made a few slides, and if you'll bear with me here. Okay, can everyone see that? Okay.
Can you put it into slideshow mode?
Okay.
Along the top where it says slideshow.
Say again, Jean. I mean, say again, Jill. What do you?
Where it says slideshow at the top, click on that on the top menu.
Okay, thanks.
And then play from start.
Okay, thanks. Sorry. I had COVID. Let's blame it on that. But also, no, I just think I'm never going to get it. Okay, so I'm constantly looking for tools and instruments that would be useful to us as a group. And I came across this, Coalitions as a Tool for Advocacy. And this came from an evaluation report commissioned by the Bill and Melinda Gates Foundation to a number of their grantees that formed coalitions in order to do advocacy. And the way that that maps onto the work that we've been doing, if you look back at that construct that we came up with for sharing information with the group as a whole to try and capture what you all are doing in sustainability, it focuses on the foundation of sustainability. Collaborative partnerships and outreach, education, and advocacy. So number 2 and 7. But the thing that was so great about this document was that embedded in those two things, they really looked at leadership, diversified, leveraged resources, and performance measurement, process, and outcome evaluation. So they pretty much hit everything. Now, the cover of it, you'll see in the graphic on your left, that's what it looks like. And the way they've organized the report is to present 4 different domains: coalition capacity and structure, coalition context, coalition strategy, and coalition support. And I wanted to say something about the report, because I think if you all opened it and start reading it, we're going to give you a link to download it. And you can download it as a document on your desktop from that. I think that it's written by 2 different people, and I think the first person that wrote, it was really pointy-headed, so it starts out as a very, very dense and hard to wade through. And then there's a second writer that's very straightforward and pragmatic and goes through each of these 4 domains. So if you're interested in the document, what I would say is have heart, maybe even just kind of brush over that beginning section that talks about doing the evaluation and go right to the lessons learned. Okay, so these are the 4 domains. There's the link, and we'll be sending all this to you too. And it's really a framework for effectiveness for coalitions as they do advocacy. And so for each one of these 4 sections, they're guided by questions, and some of the questions are really pertinent to what you all are doing and made me, I always have so much curiosity for your work and respect for all of you, but I'm kind of in awe of you after reading this, because I see the people in this group actually doing so much of what they're suggesting and doing it well. But then there were also some pearls, at least for me, that I thought, gee, these are things that people might really want to know. So they asked these questions, and then I'm just presenting this to you so you can kind of see the structure and how they present information. So, for example, I took some notes here that I wanted to share with you. Here's one of the findings is that life cycle is not a good frame for determining coalition support. Instead, use the planned lifespan of the coalition, event coalitions versus enduring coalitions. And you all that work with state lifespan respite coalitions, those are enduring coalitions. But what I see you all doing is organizing around events like the legislative state days that you do, annual conferences, sustainability planning for New York, where you actually bring everybody together. And that, according to this is a hybrid model, and it's absolutely the best model to use. And then they talked about individual lifespan or individual coalition members' roles, core members, players, and tag-alongs. And we've talked a lot about this in this group, how you need this sort of group of core members that organize things and keep things going. The players and their scheme are like people from state agencies that are really important to include. And they said one of the things they said that stood out for me is that you don't necessarily want the person in the agency with the most power, because they're often appointed positions. You want somebody under them who's been there for a while, is going to stay. And that came up in our original evaluation of projects. And then the tag-alongs, I've heard these described elsewhere as like followers. So there's leadership and followership. And I always think of Oklahoma when I think about the followership, because they have such a broad coalition and people are engaged in lots of different ways, and they have this grassroots support. And turns out this grassroots support is really important. So they pay attention to that, about how all three of those groups of people are really important, and they go in way more detail than I'm able to go into now, just to talk to you about how to involve them and make things meaningful for them. Another thing they talked about is equity support, and that not being an afterthought. And I'm just thinking about the Arch Initiative to be more competent with different groups that we're not serving, that we're not reaching, that we don't feel culturally competent to reach. That makes me think of Nevada and the work that you've done trying to reach underserved communities. And they just talk about how to involve them in the organization and the challenges that arise from that. They talk about the importance of building advocacy in your coalition, the importance of need for transition support. This one, the next to the last one, I thought was really important. Turning over all tasks and responsibilities to staff at a member model coalitions reduces the effectiveness of the coalition model. A clear active role for members is important. And when they did this evaluation, they talked to many, many members of coalitions, and they evaluated the coalitions throughout the grant cycle, and then interviewed the Bill and Melinda Gates Foundation people that were overseeing it. So they really got different perspectives. So that's just how it goes. Let's see, what were the other things that I wanted? Oh, one of the things, little gems that I learned was that, you know how we always do legislative day and we do advocacy around legislative day, and they talked about educating our representatives when they're running for office, because they're more likely to listen and you're more likely to influence their platform. I never thought of that. And I have my, where I live, we're represented by Pramila Jayapal and Adam Smith. They're both really powerful in the House. And I've sent them stuff, and I've talked to their staff, and like they've never done anything for respite. But you know, once a year they come to the little clubhouse 2 blocks from my house. And it never occurred to me that that would be the time to like say, hey, this is really a big issue in Washington State does this. And so anyway, that was just a little gem. Another thing that came up that they talked about that I thought was so important was how you evaluate to know that you're really effective when the work that we do takes place over years and years and years, and you could be doing something really important, but it might not show fruits for a long time. So they talked about that, like how to capture that, and the importance of when we're reporting to funders, not just reporting for compliance, just to show, yeah, we did what we promised, but to generate data that's really meaningful to our stakeholders, to our coalition participants. Alabama is really good at that. Oklahoma is really good at that. Nevada, actually, all of you are really good at that, all the people in this group. So anyway, it goes through each of the 4 areas, and they give you tactics. This was just one example. Decision maker engagement, that's at legislative day, versus public mobilization, and how using a kind of 2-pronged approach to make change in your state is really important. And then they talk about how to do that, and how even though you may have a few people who are decision makers engaged, without that grassroots activism, you're not going to have any real important social change. So we'll send you the link, and I'm hoping that some of you will just take a look at it. Like I said, don't worry about reading the first part unless you're really an egghead and like that sort of thing. But see if there are any gems in there that you can use to bolster your work. Okay, that's my little thing. I'll keep looking for things for you, and I'm finding some good stuff, so I'll just keep passing it along. And without further ado, I'm dying to hear from all of you. We haven't talked in weeks and months almost. So let's hear what's going on everywhere. New York, you're here in force. You want to start?
I don't know. Abby, you want to start?
Me?
Yeah, that's what I thought
Go
you'd
ahead,
say.
Doris. You're doing all the work.
Oh, Dina's here too. Cool.
I know, this is great. I love it when you're all here.
I have a few things I can think of that are worth reporting out on.
We want to hear.
Sustainability. So we successfully issued our program standards finally to all of our area agencies on aging, which we have 59, for our Title III program, the National Family Caregiver Support Program. And we were able to expand our caregiver directed model to include offering respite vouchers with those Title III funds.
Fantastic.
And I'm not sure, I think I reported this out on a previous meeting, but the coalition, launched the voucher program last January with lifespan respite dollars. And like the idea behind that was thinking that, there would be this system in place that if any of our AAAs may have interest in using NYSERC to help administer the vouchers with that other pot of money, that they would be up and ready to go to do so. And we actually have one AAA who is in conversation with the coalition and negotiating a contract to do just that. So we're very excited that that's hopefully gonna play out the way we expect, and then others will want to replicate across the state. So that'll help sustain the coalition in that area of work. And then the other thing I was thinking of was what we were just talking about with our Caregiver Wellness and Respite Center that we launched. They just actually have been operational since July of last year, but they cover a 6-county area up in the northern part of our state that's very rural. And they're using lifespan respite dollars to serve, all populations of caregivers up in that region. But because of these program standards going out and there being a requirement of a caregiver assessment and case management, having to be done, even under our 3E program, the National Family Caregiver Support Program, although it has more strict eligibility guidelines, we had a conversation this morning about connecting, our entity that we're working with for that Caregiver Wellness and Respite Center with the 6 counties to talk about how they're going to coordinate services and be sure that, there's no duplication happening, and that if the AAAs had interest in using them to do case management work, that would be something that they could offer to do. So a lot of exciting stuff happening, I guess, and when you're thinking about the potential for sustainability.
Well, and just the way that you go about this. So I'm thinking back to that report, and one of the things they talked about was the importance of branding only when you have a good reputation. Like the branding itself, which I think that we all think a lot about that when coalitions start. But the reputation you're building, because one of the things that I really find remarkable about everybody in this group is that you don't just create something and then you're gone. You all stay engaged and you all look to make database decisions and make sure the standards are there so that it's not just, this creative idea that people had, that you stick with it and continue to engage with people that are doing the work. And so you just see that I just have watched this tapestry being woven in New York that just gets richer and stronger, and
More
it
stressful.
would be hard to undo it at this point, right? You're really embedded.
Well, I think we are really embedded and it's exciting, and we have a lot going on. And I appreciate that you shared this because I'm coming near the end of the Grantmakers and Aging project, and we have successfully pulled together an advocacy, a legislative advocacy committee. We're working to replicate the Alabama governor appointed board. I have a call with Tracy a little later today just to pick her brain on what I do next.
That's great.
The coalition, the master plan on aging plan has come out in partnership. It's NYSOFA in partnership with the Department of Health, and the coalition was asked to participate in that. And so that's a very exciting piece for us, because then we'll have a platform to actually push that concept, right?
Yeah.
The other huge piece is, of course, us landing the AmeriCorps grant in September. That's a $3.1 million grant over 3 years. I have been laying the groundwork for that. It covers 6 counties in central New York. So we have our CWRC up in the North Country. We have the AmeriCorps swath through the middle of the state. And we just hope to keep going with those kind of little pockets of work
Right.
through future grants. But we have grown, the coalition itself has gone from me to 6 staff. We have just hired a marketing, membership, and events specialist, which I'm really excited about, because it takes all the social media, all the newsletter, all that stuff off my plate so I can focus on other things. But we're really going to focus on a solid membership campaign. If anybody has any resources about forming membership, because I saw in the beginning, it's like we still can't define membership, right? We've tried and tried and tried to define membership, and it's a serious frustration. But
so you were looking at California. You were looking, Dina, you sent me a form from California about membership with their coalition, and they had like an application and some requirements. Did you ever talk
we
to them?
soft launched a membership campaign at our last conference with really just information and an announcement, and it went nowhere. So I have to come up with a different approach. And the other thing maybe we could talk about is we've gone round and round and round in the coalition about the difference between a sustainability plan and a business plan, and whether or not they can be combined effectively. It is a goal in our work plan to do a business plan, and I feel like we had a funding plan which said our biggest and highest dream was $1 million, and now we're busting out at the seams.
Yeah.
So we kind of have to revisit that. So we are scheduling our next sustainability retreat for the spring. But wondering if anybody has any thoughts on that besides Dina.
Yeah, I wonder too. Is anybody else puzzled over that, the difference between a sustainability plan and a business plan?
And can they just be effectively combined into one thing? To me, it's all it's hand in hand.
I
So
know that. Yeah. So what would a business plan have in it that a sustainability plan wouldn't have in it?
see, Dina, you need to come in here now, because this is where I get lost. I'm just like, I don't.
She always looks to me, and the funny thing is, when I went back to our
This is
notes,
your bee in your bonnet.
no, this came from Tom when we met in our retreat. In our notes,
I'm gonna turn
Tom
it on.
actually said, you know, that we could have a goal to create a business plan for the coalition. So we wrote it into the grant proposal. Now it's a deliverable. And I think because we're in such a different place from the time, right, like when we met and kind of talked through I'm sorry, my dog is like driving me nuts right now. My daughter has a friend over and she just wants to be with them. So, you know, it's just, I sent you everything. Did you get it, Doris? So I think you do need to have a conversation with Tom, because I feel
Well-
like maybe he can kind of give us some feedback on why he wrote it and what he was thinking when we met. I don't know. It's a
And
tough
do
one.
I have the notes from our sustainability retreat, and I thought that the way that Tom described it was really helpful. So he said that the business plan contains the strategic and the sustainability plan, but the center of the business plan is the operations of the coalition. So like the strategic plan is overarching part of the mission, the vision, and the goals. The sustainability plan is looking at continuation and growth of activities, changes. So the business plan would be both of those combined, like the strategic plan and the sustainability plan. And I thought that was helpful.
I feel like that's what we have, and it just needs to be updated. I
I
mean,
think you have to have like all the parts that you need and like worry less about what you call it. That the document that I presented this morning would be
helpful.
it would be helpful, and it talks about it describes things in a way that's consistent with what Abby just said, that Tom said.
I will read it over and send it to Tom before my meeting with him next week. So
Yeah.
thank you for that.
I
Sure.
wonder if it's also worth looking at when Marilyn Sword presented on that,
Right.
because they're engaged very specifically in a business plan.
We
So,
spoke
we
with her.
talked to
didn't we?
them.
We had a meeting with her,
Yeah.
and she actually gave us, I think, the contact information, but it did seem a little different, I think, than what Abby just described, but.
Again, I think Susan's
met
point
with
is very,
Go
oh,
ahead.
sorry, go ahead.
Well, we met with a business plan consultant. I think we got it from Maryland, right? We got her from Maryland? No? I felt like she thought we had a lot going on in the right direction, and she just said, well, if you need me, let me know, because you seem like you're doing really well.
So what I think it means is that you need to run your coalition like a business, right? You need to know people need to have roles and responsibilities, and you need to have accountability. You need to have diversified funding so that like when one source runs out, everything doesn't go down the tubes. You need to have a transition when your funding is ending. And you need to plan for that ahead of time, which is the sustainability part. But it's what I said earlier, like I'm just in awe of all of you. I would not be good at what you're doing. I have my skills and I could be supportive of people like you that are true leaders, but you have to, I think, understand that what it means to be a leader in your organization. What do you expect from a leader, and what do you need in the way of support, and how do you plug people in? How do you match the right people with the right tasks, which seems to me that you all are good at doing, but just to be intentional about everything. I think that's part of a business plan. How do you spend your money on leadership and evaluation and education and advocacy? Like what's your
I feel like it's all
allocation?
there. It just needs to be put into a document,
And you're good at that. New York's good at that. And I think that's really important.
Tom is really good at that.
Yeah, Tom's really good at everything. So I don't know, Tracy, am I like totally off base on this? You've kept things running a long time.
Yeah,
really diverse way.
as far as a business plan for the coalition, we don't have one. We don't have a business plan. You know, and as far as the sustainability plan, I'm the same way. I don't think we have it on paper really. We talk about it.
But
We
it
know,
works because you have such longevity of
yeah,
staff and
Yeah.
such good mentoring.
yeah, and so much of it, kind of it is directed from the governor's office, and we just kind of act as the staffing entity to it. And when I say that, it sounds way more important than probably to arrange the meetings for them and make sure that we're pushing out the advocacy information to them, our legislative news, make sure that when they have those opportunities to educate and inform and network with legislators, that they know what we would like them to be talking about when they have those opportunities. So I'm just really in the background, and it is kind of a living organization that just has me for support.
This is so interesting to me because it's like your state is so productive and the work is so excellent. And so you're all you said it's sort of, you're living it, and it's not actually fancy day to day. And I think that's true for everybody. Things can sound really, but you still have to just get in there and do the work, right?
Yeah.
So
Alabama is very unique, totally unique in its coalition. It doesn't function at all like any of the other coalitions. It's really more like a quasi-governmental body that's functions in an advisory capacity. I mean, everyone is there because they're appointed by the governor.
Yeah.
So it's very different. It doesn't really need a sustainability plan. And so much of what they have is embedded in state agency funding. So they're kind of beyond.
Hasn't that grown, Tracy, though, because of the structure that you have? Because I mean, that's the beauty that I see, is that it brings all of these entities together, and you're talking about respite in the same way at the same time. And that's just got to expand funding opportunities. It's just got to.
It absolutely
it's extremely
does.
Well, I'll let Tracy answer this, but I see it as an extremely helpful body, but it's not the same as a grassroots coalition.
But can't we have a blending of that?
Yeah, absolutely. That's what I'm saying. It operates a little bit differently, like a quasi-governmental advisory board. Am I wrong?
Yeah. While the majority of the seats on the coalition, the governor appoints them all, but while the majority of the seats are government agencies, there are parent representatives, there are self-advocates, and community respite representatives, throughout the state. So there are opportunities for, individuals at a grassroots level to be involved in the coalition.
It's kind of like a developmental disabilities council.
Yes.
In the state.
It's very similar to that.
Which can engage in lots of advocacy, fundraising.
Yeah.
You can do a lot. So again, it's just, this all comes down to semantics. What are you calling it?
Yeah.
And how you structure it. And Alabama did it legislatively, so now it's really embedded in their system. That's all.
That's my goal, and that's come from all the great stuff that Tracy has shared, and the grant makers and aging participation.
And speaking to the growth, it is amazing. Just recently we have, like I said, we have all kinds of agency representatives on the coalition, but just recently the Alabama Department of Rehab Services, their Children's Rehab Services division, based on their participation in the coalition, they have always been so impressed with how we do personal choice option respite for Alabama Department of Mental Health, as well as for Alabama Department of Senior Services through their AAAs, through the Alabama Cares programs. They found respite funding in their budget this year to allocate to us to do the same as we're doing for DMH and for, the AAAs. And, and that was completely on their own. That came from the coalition activity. It wasn't us going and saying, can you find, money for this? We think your population needs respite funds. It wasn't that at all. It was them saying, hey, we're on this coalition. We know this is effective. We know our population needs respite. Let's find those dollars and get it to them. And so we're very excited, about that new partnership. And also, and I may have already said this, and I'm sorry if I'm repeating myself, but when the 5-year enhancement grant came out with ACL, and we were short on state match to be able to capture all of those funds, we wrote for what we could match. And then when the legislative session started, our coalition went hardcore and went and got in front of our legislators and told them how important this was, that, we'd be able to, capture those if we have the opportunity in the future. They granted us more state funding for any potential federal dollars coming down in the future. And so we were able to actually go back, and ADSS wrote to C, they contacted ACL and said, can we recapture what was left on the table? And ACL said yes. So we were able to recapture those for, the budget year. And, that was great because we had that coalition support and had them get in front of the legislators, and they worked to do that.
Yeah.
With, of course, Cheryl was down there too, but but she's on the coalition. So that was great on their part for, the coalition to see the importance of us being able to match those federal dollars and to educate our state representatives on how important it is for them to be, able to match those dollars.
So was the coalition in Alabama at one time grassroots and then grew into this?
It was when Alabama Lifespan Respite started in 2000. They just brought together, it was about 45 individuals from across the state, and it was agency representatives and, self-advocates and, everything, parents, very diverse group of people. And they were able to do a lot of things and take it from a respite program just here in Huntsville to, start moving out through the state and, adding some resources and adding some supports for caregivers elsewhere other than Huntsville. And once that change started taking place, that's when, Cheryl spends a lot of time in Montgomery, and the two ladies who helped found Alabama Respite with her did too. And so they went down, got in front of the right people, and our legislators were the ones who suggested that this become legislative, that it, that we, have the state support it.
Yeah.
So I think it was in 2009 when that really started to take off as an idea.
So I remember when interviewing you for Innovative and Exemplary Practice, and I think we may have talked about this at the time, but I thought about it as you were just talking, and I thought about it when I was reading the document I presented earlier about the branding and the reputation. And I think the actual work you did, like in the Hearts program, I'm guessing that like you were visible and you had such a good reputation that the idea of respite wasn't this like esoteric idea. It was like a real thing that people knew about and cared about. And I think that must be, when you were talking about business plans, it's like have something concrete that you can show people. And then the relationships with the legislative members, they're not one-offs, they were relationships, right?
Yes,
that's one of the things that also they talked about in that Bill and Melinda Gates evaluation, that you have to form these long-lasting relationships with people.
Yeah, you absolutely do. And we have great support here in Huntsville, but those relationships and that support, when we go to Montgomery, we go to them and have them make introductions to maybe new legislators, new people new to the arena. And because they're so well respected, we have that relationship with them, then it's easier to get our foot in the door, with other representatives throughout the state. And but yeah, having those real connections and to just pop in and say, hey, this is what's going on, or give them a call and say, or see them out at a lunch or anything, and just kind of keep respite on their minds is so important. So we do that at every opportunity.
Yeah. Well, there's a lot to learn from you. Okay.
I just
Um,
want to jump in and share successes and again, we call maybe not the business plan a strategic plan.
mhm.
And we're having that next week. It's been a few years since we've all sat down. When I say all, I'm talking about those key statewide programs that also have respite programs. I really know firsthand the coalition is just that driving force of relationships and connecting, communicating across what could be siloed, unintentionally siloed programs. But I think all of you know we have an active coalition with subcommittees, and honestly, those statewide coordinators are also in regular communication. So talk about relationships. And I think that's huge because it's really to benefit the caregivers, right? It's really to get away from if a caregiver contacts one program that they may not be a match for, but getting them to the right respite program that they are eligible. And again, I can't emphasize enough that daily working relationships across multiple programs. And then the other couple of shares I know I've got to be mindful of time, but just as I was trying to quickly think about those successes related to sustainability, we're getting ready we're already planning our November statewide family caregiver conference. And because of the work under Lifespan, we actually, again, through coalition, through the partnerships, we are partnering with now the Healthcare Authority long-term service and supports. We've been able to leverage some funds to have what we're calling 5 in-person sites across the state, as well as virtual. And so, that's just our world now is hybrid. And we have certainly received positive feedback from caregivers that appreciate attending virtual. But on the other side, we have certainly recognized there's just nothing like in person. So we're really looking forward to not only one site being in person, but having 5 strategically placed in-person sites as well as the virtual option. So
Oh,
again,
that's
that's a
smart.
partnership.
Yeah.
The other thing that just quickly, we've been able to leverage new funding through State Department of Health. And over the years, because of our success with Lifespan, we've had those state programs contact us. I would call a couple of them have been more like supplemental funding. I think it was even Tracy that maybe mentioned that perhaps they find that they have X dollars and they can't maybe commit to renewing it annually, but they have it at that time and they fund respite. So that has really helped sustain Lifespan funds because many, the ones I'm thinking of, it's the caregivers that have children. And so again, on our side of things, we're able to match those caregivers with eligibility and then it frees up Lifespan funds. So I would really highly recommend, if you haven't already, do contact your Developmental Disabilities Council because they have been, again, one of those state programs. I know Jill mentioned them. They actually funded what we call caregiver retreats. And it's pretty exciting because it's an enhancement on the respite vouchers. These are respite experiences, I guess, if you will, like a weekend or an overnight stay. So again, that work under Lifespan has just really benefited to reach caregivers in other ways related to respite. The other one is your Maternal and Child Health Bureau Title V. Again, I would highly recommend, if you have not had a meeting or contacted them, please do, because they are a great example of a partner that was able to step up and provide some funding. Again, maybe not commit annually yet, but I'm hopeful because they know respite is a priority. And again, that's through those
I guess, the work under lifespan. You just never know how those other state programs or funding opportunities will be able to evolve because of the relationships, the collaboration, the coordination under lifespan. So that's just a speed share of some successes going on related to sustainability. And I'm sorry, one more is Oklahoma State Department of Mental Health, our systems of care. And I believe maybe it was Tracy as well that mentioned they have a respite program that is dedicated dollars annually. And again, it's for those caregivers that have a loved one with a mental health diagnosis. So that's again a success, and I would highly recommend, if you haven't reached out to your State Department of Mental Health, perhaps that is another respite voucher opportunity for those caregivers that meet their eligibility. So that's just a quick speed share on sustainability.
That was really great. And I mean, you have a long history, I think, of being really inclusive, but also really productive. So going back to the business versus sustainability plan, how do you, the group of you women in leadership positions, how do you all work together? Just like functionally day to day, how do you run things and make things keep going, sustain things in that way in your day-to-day work?
Honestly, I think it's we're just in regular contact. I think things come up that are unique, and we're just like, what about this? What about that? I know all of you know, we're the subcontract. Sooner Success is a subcontractor of our aging services, and I think we have a unique partnership in that we work very close together, and on a regular basis. We have a regular standing weekly meeting, as well as on the day-to-day as that needs to come up. And I do believe that strong partnership has just allowed us to even improve upon the already supports that we're striving to have for caregivers. And that weekly, meeting that we have, and on top of as things come up, I just know it has it strengthens supports for caregivers, because what's awesome is in Nadine's position, she's obviously working with multiple statewide programs too, again, so she's also able to help with coordination, again, that unintentionally gets siloed, which then transpires down to keeping up with on the service delivery side when it comes to respite from our angle. So it really is that I think closeness. Now, when it comes to the strategic plan, again, those partners that participate, it's not just bring them together every few years and let's share us your thoughts. It is, I believe, intentionally trying to always foster those stronger relationships on a regular basis. And I can just say firsthand, they too have like standing meetings, but they also feel comfortable with just, sending an email, calling as the day goes, if unique situations come up as they're helping caregivers. So I think it really does come down to strong partnerships that not just on paper, oh yes, we partner with. You actively, intentionally know who those are. You're working with them on a regular basis. You're communicating with them. And I would just encourage, if some of your key programs that you think, oh man, they would be a good partner, you almost, again, it's just about relationships. You almost have to start off with a standing time, whether that's your coalition. And then, I think organically, hopefully, you're able to just build upon that. And again, if maybe they're not actively participating in your coalition, picking up the phone and say, hey, I know you haven't been able to attend. Is there someone else in your program that could attend? Because we've got to have everyone, at the table to help caregivers, honestly. I hope that answers your questions.
No, that's really enlightening. And I get the impression, so we're talking about shared leadership at a certain level, but I get the impression that you also have strong relationships with people around the state at the more community-based and grassroots level. And I'm thinking back to an interview I did years ago with a state that had lots of funding, but the leadership was more sort of at the top, and the relationships were kind of tenuous with, I mean, that was like one of the challenges for them for sustainability, because you have this money and you can't always spend it because you can't get people doing the work. So have you found something that works in terms of sustaining those relationships and making sure they're fruitful? Like, how does that work in your state?
Yes, and I think why we're such a great subcontractor is our program was started over 20 years with the premise of community inclusive capacity building. So as a program, we have county coordinators is what we call them. They too work actively on community coalitions. And I again, what's happening quarterly at the state level for our statewide caregiver coalition, it's happening on a monthly basis at the community level. So I believe that's a real strength, because we, of course, know every community, even though there might be some, commonalities in terms of challenges and difficulties, they're really the driving force of what are the priorities in their community, and I know we all agree that that's the dream in terms of those communities having the buy-in, and they're the leaders in terms of what it looks like at the community level. It's just really continuing, not just like, oh, that's a community thing, this is a statewide thing. It's all works together. It all has to. So having participation, again, I believe, of our team that's regularly working at a community level, and also participates in the statewide coalition. That's a real benefit, I believe, that helps with that.
That makes me want to hear from Corey, because I think the work that you did, and I went to a virtual planning meeting that you did about 2 years ago, maybe it was 3 years ago, but I think that's been one of your strengths too. Would you just talk to that about that connection between leadership at the state level and community buy-in, especially in a rural state, and as state where it's hard to get bodies together, and that you have diverse communities? And
that Anne Marie can probably speak a little bit better to that, but for our coalition, what we've been able to do is we had monthly meetings and have them, and we had always done them by Zoom or some form of Zoom, but we had like rooms where we had them in, and the state has always been a big supporter of ours. Cheyenne Pascal and Jeff Duncan have always been huge supporters of ours for that reason, trying to help us reach out and get it into the rurals and things like that. For my organization that I work for on the daily, I go to the coalition meetings in different organizations for the different counties and such. So like for Lincoln County and Nye in the rurals, I go to those so I can reach out into those areas and try to remind them that I'm there. It seems like I am in meetings more than I am doing my job sometimes, but that's all of us, I think, right? That's my husband says, oh, you're in another meeting, so it's just an excuse not to do work. No, I just work longer hours so I can attend these meetings. But I think we're all in that boat where we try to reach out and be as present as possible in different areas. There are times that I make the trip into the different areas and go from there to show my face, so it's not on the screen.
Yeah,
But those are planned meetings, and we try to organize those and collaborate with other agencies so that they can do rural outreach at the same time. So we're all hitting them at the same time, and they get the same information, and they get as much information as possible at that time.
yeah,
So I know our coalition works well with Infor Neighborhood Nevada, and I don't know what the other two ends stand for, but they do a lot of outreach up in Northern Nevada. Amy DeWitt Smith, she's on our coalition as one of the board members, and she sort of does the whole gambit of the lifespan. So that is really important. And we all, you know, even when I go out for Helping Hands, I'm promoting the NLRCC, the Nevada Lifespan Respite Care Coalition. And like Aida said, we don't just support our own organizations and stuff. We make sure they have resources for everything. I spent an hour yesterday on the phone with a client that needed resources for her mom. And, you know, I was like, okay, well, let me look up this number. Let me look at, that's not my job, but that's just, we do it because we want them to know that they can talk to us and go to us and they can trust us. So
Yeah.
that's what we're all here for. And
yeah, the branding versus reputation. So, yeah, and then, and reciprocal relationships and
Mhm.
relationships over
Exactly.
time. Yeah. So, Anne Marie,
I had other things to do in that hour, but it was important
Yeah.
for her,
Yeah,
and it will build that relationship, and it helps my reputation, I guess. But I'm not as worried about that as making sure they get what they need.
yeah. So, and Anne Marie, maybe you could talk about that too. And that, you know, when I think about all of you, certain things come to mind just from knowing you from these meetings and reading your reports, and everybody in this group. It's like you just deliver. And one of the ways you deliver is knowing what's going on in your organization, evaluation and data, and meaningful data, and really skillful reporting. So, and I think about that. I was really taken with this report that I described to you today, because it was so thoughtful about the importance of doing all these things that you do. Maybe you no longer think about them very much because you're so used to doing a good job. But I just think, you know, it's good to go back and like remember what you're doing and why you're doing it and how it fits to sustain. So, Anne, would you just kind of report in and talk about how everything looks to you from a leadership point, and, you know, in terms of the things that we were talking about, relationships, planning, grassroots advocacy.
Yeah, honestly, I really look to all of our community partners as the leaders for Nevada, because they're the ones out there, you know, providing the services. We as a state are essentially providing that funding and support and technical assistance for them to go out and do the amazing work that they do. And I think the coalition since 2009 has been steadily and gradually trying to build itself. And it's to this point, I think that's really exciting now because we have a solid foundation. We have good membership in that coalition right now. And we just had a really, really exciting meeting about a month ago to develop the state plan in a hybrid meeting together with everyone providing input. It was very inclusive. It made us all think of these different things from different viewpoints that, you know, we as a state might not have considered, or someone in the rurals, or someone in a metropolitan area. So I just thought that was really just amazing to be part of and just to listen in, especially from my role as a caregiver support coordinator, things that I need to pay more attention to, things that I can do better to support our partners. And we now have, you know, a state plan for the coalition that's getting approved and implemented over the next couple years. And the coalition, thanks to Cheryl's amazing leadership too, has really started to get involved with legislative actions. So I think that's really going to help drive the coalition forward. And I don't know if Corey has any more to touch on that, because I haven't been as involved, but I just think the direction we're going is amazing. And it's only because of all the people involved and continuously communicating with each other, like you said. That's imperative.
Yeah,
So
I
is the
know we
lit-
have
is the
a,
lit- oh, sorry,
no,
go
that's
ahead.
fine. We have a beat because Anne Marie said something about the state stuff. We do have a BDR that has been written with our input, and that's being looked at the legislative level. And we are also commenting on a couple other laws and stuff like that are going to a couple other BDRs, I guess would be the term, politics and me. So I'm a really good people person. I just, it's all above my head. So I know we have a couple of those things, but I did also send that link to Cheryl because she's just can't be on every single meeting. So she relies on us. So I sent that link, and I'll send the chat, a copy of the chat to Cheryl as our executive director for the lifespan. So she can, go through all this stuff too. So yeah, she relies on us to glean some of that information for her.
So the state plan, was that what you've been working on the last few years, where you brought people together and had focus groups? And
yeah, I think overall that is what we were working on. And we just finally were able to, since we changed the direction of how the coalition was going to go, it became more of an advocacy thing. So now it helped us solidify how we wanted that state plan to be. Bye, Dina. And so we, Cheryl's been working really hard with Cheyenne on that at the state level, and she came up, like Anne Marie said, we had a really good hybrid meeting. We had one room in Reno and one room in Vegas, and we were all together. And we just all sort of brainstormed and decided what was important to us and how we wanted to proceed with it.
yeah,
And sorry, just one more thing. And now we're also using that plan from the coalition to take another look at all of our lifespan projects to see how we can implement the coalition's efforts into those projects. So really, it's like the national strategy has informed them, has informed us, and it's trickled all the way down and around the state. So I think
so
that's
nice.
also, really neat.
So it's not going to just gather dust on somebody's shelf. It's like
no,
putting
we're
into
using
practice.
it for the trainings, like Anne Marie said, the training that we're doing from Wisconsin and all that kind of stuff. So it really is going to be a big rollout and a big win for the state when it comes to respite.
That's fantastic.
Is there a copy of that plan available yet? Sorry, Susan.
Oh, no, go ahead, Joe.
No, is the copy of that plan available yet?
I don't know that it's been solidified yet, Jill. As soon as it's
okay.
solidified, I can get that plan to you. I think we're still tweaking it a little bit. And as soon as we have finalized it, I would be happy to get you a copy of that.
And then, of course, present it to this group.
Yeah.
Yeah, I'll have Cheryl on for that.
Yeah, we would love a presentation. And then I'd also love to, since I can't be a fly on the wall, New York and Alabama having a conversation about membership. Let's hear back from you all next time. So that was great. Any parting words, anybody? Thank you so much. I'm smarter every time.
Oh yeah, I learned so much from all of you.
Yeah. What a good group. Okay.
Nice to see you all.
Nice